Okay. So we were just talking about your experience with Lyme and how you're helping people get treated and even identifying if they have it or not, because that's something that's often like not thought about, overlooked, or like improperly assessed. So maybe speak to like what your experience is or was and how you're translating that to your clients.
Right. So Lyme is not well talked about nowadays. I think you start seeing it a lot more in the publications or, from your government officials just saying, hey, watch for tick bites. But there's so much more education on the vaccine around it and how it causes, systemic types of issues and not just something that's localized. So just to stem back to my own personal story with Lyme, I had symptoms for about 6 years during university time and prior after. And at that time, I was playing, pretty highly competitive hockey, really athletic. And over time, symptoms just started to pile on. And, as symptoms started to pile on, you start going to doctors, they start sending you to specialists. And, being at that age, they always say, hey, you're too young for this. You shouldn't be experiencing this, or it's anxiety, or it's depression.
What was
right?
the symptom that you felt like looking back stood out? It's like, I don't know how this was ignored, or how did I explain this away?
Yeah, so my first symptoms, I would say I was having heart palpitations and crazy anxiety and crazy depression. So, I mean, they kind of go hand in hand. If you're anxiety, you can get heart palpitations, etc.
Sure.
Right?
Did they do anything, or they just say like, maybe you just have anxiety, maybe you should talk to someone, you should take a medication?
Yeah, so, always at that time, I'd always listen to, those recommendations from the conventional side.
Mm-hmm.
So, yes, I did, see a therapist at the time because maybe, being a, student athlete, trying to juggle hockey and school, maybe it was too much for me at the time.
Sure.
So I'm like, sure, let me just try and explore that avenue. I even went down the avenue of taking anti-anxiety prescription medications. They did work at the time, but I found they started not working.
Yeah.
Which kind of during that time, things started to progress more. So each year that went by after seeing, hey, cardiologist for your heart palpitations and heart skipping issues, I started developing more of the neural symptoms. So like the tingling, the buzzing sensations, OCD, ADD types of conditions. So neurologist was kind of the next step. Look at all the muscle function, do all like your specific, even brain MRIs too, to rule out MS types of symptoms or conditions, right? And still, like everything was coming back normal. And then it's like, here's your colonoscopy now, your endoscopy for your heartburn, your constipation issues. And it was just, every year is just going through that same cycle, but nothing ever coming up, right? Everything's A-okay, like your blood tests are normal, like you're just a high athlete, like your heart rate's low because you train so hard. But at that time, like my heart rate's beating at 30 beats per minute. Like that's not an athlete's heart. Like that's crazy low, right?
And looking back now, how does Lyme impact that?
So Lyme is so systemic, right? So with Lyme, you technically get multiple infections. You get multiple organisms. And basically what they do is they hinder the immune system, right? So they start to slowly degrade the immune system. Mm-hmm. And then Lyme can burrow into different tissues, organ systems, right? So there's even Lyme carditis where it can affect the whole heart function, muscle function of the heart. So people will have arrhythmias related, but then, you're going to check your heart and they're just giving you a prescription for an arrhythmia if I have tachycardia types of syndromes, right? But they're never getting to like, okay, what's the root cause of why I have a localized symptom, or I have 30 plus symptoms going on at the same time. Right. So that's where like the specialist can kind of help and rule out anything, important at the time. But, if things aren't coming up, there's way more to the picture underlying to investigate. Right. And that's where, some people just kind of quit at that point. They don't even look into alternative medicine type of world, right?
So how did you get yours diagnosed?
So yeah, so like during, like I said, going back through university, had symptoms escalating. By the time I came out of university, I kind of hit a breaking point where I had, like I said, those 40 plus symptoms, more neurological symptoms. And then at that time, I was exploring multiple naturopaths, and no one can figure it out. And then one naturopath, actually, he did Dr. Horwitz's clinical questionnaire, where it's a series of questions, and the more questions you have checked off, the more likelihood you can have tick-borne infection.
Yeah.
So he went through that, and he's like, I think you should test for Lyme disease. And at that time, I had no idea what that even meant, what it was. I'm like, okay, well, how much is this test? And they're costly. Like, it could run upwards of like $400 at that time for a basic test. I'm like, okay, let's keep it on the back burner, but I just think like we should just treat gut issues and whatnot, right? 2 months went by. I'm like, listen, let's just do the test to kind of see. So we did a test from German labs. They came back, and a bunch of things were positive on the test. I had no idea what they meant. And he also said, listen, he's like, I can't help you on this because I don't know fully everything. I think you need to go get additional support. That's someone who specializes in Lyme and chronic infections type of thing, right? So from there, my journey began. I went to a clinic downtown Toronto. At there, tested for everything. So I tested all the tick-borne infections. I tested mold exposure, tested the whole SIBO, tested the whole gut, tested the hormones. And then, sitting down, he's looking, going over the results, and he's like, there's a lot of dysfunction going on there, right? And in my head, I'm like, well, why isn't this kind of picked up in conventional medicine, right? Where, blood test is dysfunctional here, but my blood test is normal from a conventional side, right? So, at that time, I'm like, whatever, it's like, I got to improve my health, like just, whatever you kind of say, protocol, whatnot, I'll do. So then they actually gave me the option at the time to take herbal therapy or antibiotics. At the time, I was kind of against antibiotics. So I'm like, I'm just going to do the herbs and stick to the naturopath in the clinic. He's like, fair, you can just come follow up with me. But as time went on, the protocols were just so large, right? So they're giving you like 20 different types of herbs and supplements and detox regimens. It was just so overwhelming. So during that next 6 months, I depleted even more. Had to go on short-term disability, eventually to long-term disability. And then at that time, I was trying to figure out, okay, what do I do now, right?
In hindsight, did you end up with the antibiotics, or would you have started with that?
So at that time now, I explored treatment in the States.
I see.
So I went to a clinic in Florida, and it was more of a natural healing center. So they did, therapy. They did IV therapy as well. They did like Beamer mats to help like the blood flow circulation. 6-week treatments, costly. And I left there still feeling the same.
Yeah.
Right. So now I had this mental battle of, hey, I'm flying home trying to be well, right? Because people have supported me so much. But also thinking, I'm like, okay, why aren't any treatments really working, right? Like what's actually going on internally that's causing a lot of symptoms, right? Then from there, once I got back, I decided to go to school, holistic nutrition school, learn more. Obviously still studying like the whole chronic Lyme stuff and mold stuff, right? And then fast forward the last 4 years, I've worked with an MD, but also explored my own avenues as well with the whole herbal field. And then from there, I started seeing increase like energy, weight gain, like good weight gain because I was underweight. Dietary changes were helpful, obviously, but the herbal therapies, I would say, were the most.
Was this herbal? Like, this is what you self-prescribed?
Yes. So I was self-prescribing, also working with another alternative medicine practitioner. Just so like getting a second eye, always understanding, educating back and forth type of thing.
And were these herbal remedies, were they like addressing everything? Were they antimicrobial? Were they like lymphatic? What maybe just a general idea?
What's good about the herbs used in, let's say, tick-borne infections, right? They become antimicrobial, antiparasitic. They help modulate the immune system. They help with blood flow, blood capillary, oxygen delivery. They help with the lymphatic system, right? So that's why they're so versatile, because, you know, even from testing, we can't even pick up everything from testing nowadays. So it's like, okay, we can be broad spectrum. But we also can use, you know, from literature, herbs specifically for, hey, I have Lyme, Borrelia, or I have the co-infections where we can talk about like Bartonella, Babesia, which I believe those are harder organisms to treat, right?
So, I mean, there's so many questions. When you kind of did that definitive test, were they all active infections, or were they like the sign of a previous infection, or both?
Yeah, so there are a few different labs. So there's Igenix lab from California, there's Armin Labs from Germany, and now there's Vibrant from, I think it's California as well. So they're looking at current infection plus previous exposures to infections.
Right.
So they're looking at, you know, IgG markers, IgM markers, looking to see if previous exposures have been reactivated too as well. Plus it's testing, hey, there's multiple species with these infections, not just one species or one, you know, hey, Borrelia burgdorferi, there's Borrelia burgdorferi plus 20 species, right? That the conventional side, they'll do Lyme serology, so blood test, and they'll never pick it up because it's never in your bloodstream unless it's like really acute
and active.
Yeah, which is, you know, 99% of the time is you're never going to pick it up. You know, that's the CDC type of
So
standard,
I got to see a live blood analysis. I did the live blood on someone who had active Lyme.
Wow.
And I have to dig up the video. It's exactly what you expect.
Yeah.
Spirochetes swimming around. And to tell someone that's what you're seeing in like a medical field, they think that's crazy.
Yeah. So there's obviously some controversy there.
But it's there, actively there. And I have to say, I've seen that similar type of spirochete, quote unquote, activity in people who don't have Lyme. So what do you think about that?
So even like if we think of H. pylori too, H. pylori is technically like a spirochete.
Right.
Even like, I think it's like sometimes some of the forms of malaria too are spirochete. The difference between like say H. pylori and Lyme is that Lyme changes forms.
I see.
So Lyme will be a spirochete form, which could burrow into the tissues. That's where it can hide from the immune system. But it also changes to L form and cis form. So I think that's become the most complex in how to, you know, support someone with these issues, is because you want to tackle all three forms. So you want to tackle what's called these persister cells that they basically hide from the immune system. Right. So you take an antibiotic, right? People feel better on them, but then all of a sudden they come off antibiotics and all their symptoms come back. Because you're actually making more persister cells, which are going into dormancy, and then, hey, another trigger, whether it's a life trigger, like a stressful event, whether you pick up, you know, some sort of chemical exposure, and all of a sudden you're full blown inflamed again, and hey, I'm coming out to play again, kind of thing, right?
Yeah. This is cool. There's a million ideas, a million questions. What do people say when you introduce this idea to them as a practitioner, saying like, you know, I think you have signs of Lyme. Let's rule it out. Is there like a lot of resistance? Is there some people that are like, you know, I always had a suspicion, maybe I just didn't know how to go about it, or someone else did a test and it was negative? What do you say? What are your experiences with that?
There is a lot of resistance, right? Because of what's advertised from Google or from, you know, just the CDC standard. So, you know, even CDC standards to now, it's like if you find a tick bite on yourself, you know, you're taking 1 day of doxycycline, which is their antibiotic, and they say it kills everything. Very false, right? Whereas before it was actually 21 days, and all of a sudden it's 1 day. So it's like things have changed there dramatically.
Sure.
And people are on antibiotics for like 6 to 8 months, like, and they're on like multiple antibiotics.
Yeah.
So, I mean, there is a lot of resistance. So it's taking the time to educate to these people,
Yeah.
right? And exploring these horizons.
Is that always the case where it's a tick bite?
No, so it actually comes from multiple transmissions.
Oh, yeah. Okay. Tell me.
So tick bite is like everyone sees, hey, there's a tick, I get a
Target.
bullseye rash.
Yeah.
So 10% of cases now will have bullseye rashes.
Wow.
Spider bites, fleas, cat scratches, dog bites, dog licks, vertical transmission from the mother, and now sexual transmission.
So it's a ubiquitous thing.
Yeah.
And would you say it's increasing rates of infection, or is it increasing rates of diagnosis?
I would say, so CDC reports 476,000 new cases per year with a 10% increase. I think it's a lot more. I think
if that's their criteria and they notice that amount, then how much is it really? Maybe that's 10% of the actual.
Yeah, I think it's millions. I think because testing is not fully there or education is not fully there, that we're not picking up on these. So even cases of, you think of like your neurological, MS, dementia, Alzheimer's, they're all looking MRI of the brain. Let's see if there's lesions.
Yeah.
But the causes like stem back. It's like these stealth infections, which they're not going to test for, and people will, stay sick in a sense, right?
I know some stool analysis now. There's a section, I think it's a vibrant testing as well, the gut tumor, that they do a correlation of like bacterial overgrowth and specific conditions. It's broad, but it'll be like, okay, there's an increased risk of Alzheimer's if you've got a deficiency of this bacteria. So, I mean, maybe it's not there yet, but the science is trending towards like your gut and specific infection can have these long-term systemic diseases that we think are like genetic or just inevitable.
Yeah, and we know genetics play like, a 10% role now. And like the whole, are they actually express like the whole epigenetics component to it? But yeah, the gut tumor will test, there's different bacteria correlated with specific diseases. Like, Klebsiella is like people who have like pneumonia or chronic pneumonia types of conditions, or Pseudomonas could have an affinity to like rheumatoid arthritis or like biofilms. And no one talks about like biofilms and Lyme and chronic infections either, right? So that's a whole part of treatment too, where it's like, you're treating multiple things at the end of the day, and that's the complexity of it.
Sure.
But it's understanding, hey, like, what's the symptom picture someone is showing too? Because that's where you can start to differentiate between, hey, I have more Lyme Borrelia dominance, or a more Bartonella dominant, or Babesia. So those are what I call the 3 Bs. So when you get a tick bite, or you're passing utero, or you get a cat scratch, or whatever, you're getting multiple infections. The ratios, they can change, but you're, like I said, you're getting the 3 Bs. Plus, you can be getting like anaplasma, auriculosis, mycoplasma. So,
I mean, a basic question is like, don't we have an immune system that should be stopping this?
Yeah, we should. So then now when we look at these people, so you can get, say, bit by tick, but you can have no symptoms for years because, hey, my immune system is robust right now. It's able to tackle things, etc. But as time goes on for people, it's like now with people who get diagnosed with Lyme, around 70% of these people have mold toxicity and mold exposure. So now we throw in, hey, now we have mold, and now, hey, 25% of these people have heavy metals. Add that into the layer of treatment. So now, like, you're looking at this complex picture of like, what am I actually doing to support this individual, right? I can't do everything at once either. That's where like the education given to someone. So that's where it's like other therapies can come in. Like saunas can just help with like mobilizing metals, can help detoxing. Perfect. We don't need to take crazy amount of supplements for.
It's interesting because that just before we started, you kind of highlighted like that as like a simplistic but really highly effective treatment or procedure to do is the saunas. Like, would you say infrared versus regular versus doesn't matter versus just sweat?
I would say, yeah, if people are able to exercise, that's great. Most of these people who have are like bedridden, right? So, yeah, someone can exercise, amazing, great. Infrared sauna is probably going to be one of the best because it can penetrate into deeper levels, and you don't need to stay in these, you know, whether it's blankets or full-blown saunas for hours at a time. Right? It's, 20 minutes, 3 times a week. People can start off even lower.
Yeah.
And it's like, this is something ongoing. So it's not, something that has to be like a strenuous routine on a daily.
Yeah.
It's slowly implemented, but that's how we adjust our lifestyle too. It provides the best bang for a buck long term if we're spending funds on trying to, treat chronic infections, right?
How about diet? Is there, okay, I mean, there's 2 things I want to ask. One, is there a Lyme type of person that makes you more predisposed to catching or manifesting it or allowing it to manifest? And also, is there something dietarily that you can do to either prevent and or treat or limit your experience of Lyme?
So I think it all comes down, like, we touched on is the immune system, right? So the more immune system has to handle, right, the more it starts to get more suppressed, the more everything starts to speed up on a longevity cellular type of process, sure. Right? So the more we have, we use the bucket analogy, the more we have in that bucket, right, the more things our immune system has to deal with. And if, say, we do get a tick bite and our bucket is near the top, we're going to start to spew symptoms right away. And the problem is when you get caught with that, it gets into tissues and organ systems. So now you have chronic infections, and now it's triggered all these underlying processes. So it starts to take a lot longer to, whether it's fully eradicate the bacteria, whether it's to create homeostasis again, right? So it comes down to like the immune system, but the triggers of someone's whole clinical history, right? That's why, us as in the alternative world, testing is great, but understand everyone's clinical history from birth, even from mother, right? So, I always ask people if I suspect Lyme, like, does anyone have any type of neurological conditions, Alzheimer's, MS, dementia? Because those have hidden chronic infections, stealth infections like Lyme behind them, right? Wow. And past in utero, it's like, okay, is that one exposure? What happened during their childhood? What happened during their, whether it's teenage, and if they're older, what happened through their whole life cycle, right?
Sure.
So you start to understand someone's whole clinical history. The testing helps, hey, let's identify what the immune system is doing towards active exposure, previous exposures. Let's see what the 3 Bs are. That's how you can kind of gauge on specific herbals to use, for example.
Yeah, sure.
And then when diet comes into play, I think people who have more neurological symptoms are going to benefit off more of like a fattier keto type of diet, right? Because they're going to need more cell membrane support, more stabilizations for like, hey, I have anxiety. Hey, I have OCD, ADD, right? So, even incorporating from a supplemental side, like fish oils, phosphatidylcholine, right? Very fatty types of foods, obviously organic, right? Grass-fed, possible. But yeah, diet is huge. I would say more, and I explored both diets. I actually was vegan for 15 months and then actually did the whole carnivore diet like right after. So I benefited more off being more carnivore, meat heavy type of diet. I think because the fats were very satiating. Yeah. And then if we go back to studies on ketogenic diets and like these whole brain types of conditions, there's a lot of good studies showing that it's very supportive too, right?
Were you doing like going into ketosis on the carnivore diet?
I was definitely in ketosis. I felt really, really good on it.
Yeah. You mean like just more energy, less symptoms?
So more energy, better sleeping, better cognitive health, right? So me specifically, I was more predominant in Bartonella, which is neurological symptoms, right? So I noticed like if I didn't eat enough fat, I would experience more neurological flares, whether it's like OCD, ADD. So I found like I had to have specific amount of fats per day to help like satiate. Plus, sure, having the additional supplement support, played a crucial role in just helping to stabilize, because then we get into what's called like mast cell activation and histamine issues. It's like, we want to help the cell be tamed as much as possible.
Yeah.
Plus now you bring in herbs to treat, which are going to irritate that. It's like, okay, how can we like manage and support on a daily basis from a dietary standpoint while we're incorporating, things that are treating these underlying infections, right?
Okay. How would you stabilize like mast cells and stuff?
Mast cells, so like fats are obviously very important. If someone has mast cell activation syndrome, you can use things like quercetin and nettles. Those help with like the whole histamine response. If someone's having more the digestive histamine, like obviously DAO can be supportive, but Borrelia extract and luteolin. So those are specific. Luteolin is more like an oil, which helps satiate the mast cell. And Borrelia is known to degrade histamine and help support mast cell too, right? So, and then combined with like a proper oil. So like olive oil, right? Taking it with olive oil helps, again, satiate, calm the mast cell, stop them from, degranulation types of symptoms, right?
You ever see someone that has all these symptoms but is negative for Lyme?
Yes. So that's where it's like, you take the tests with a grain of salt, because even if they're negative, you would still consider using the specific herbs according to their clinical history.
Yeah.
Right. So sometimes like people don't want to do the testing because some of these test panels can run upwards of like, $2,000-$3,000. Right. Sure. So it's like, hey, let's use the herbs. Then it costs us a couple $100. But if we start feeling symptoms, hey, we have a pretty good idea what's kind of there, right? So a lot of people do feel, these Herxheimer detox reactions. With Bartonella specifically, you almost kind of want to feel that, right? Because like you're really hitting something, and if someone's more neurological, they're gonna feel it. But we have ways to help obviously mitigate that, right? Yeah. But that's a good test, right? I mean, that's a cheap test. You're on herbs, very safe, little side effects, right? So it's like, hey, what's the best bang for the buck if someone's in a financial state? Yeah. It's like, hey, let's try the herbs, right? Your symptoms match, but might as well try, because hey, the herbs are tackling just more than the 3 Bs or Lyme, right?
Sure.
It's going to tackle, hey, maybe you do have a parasitic infection or yeast overgrowth or candida overgrowth, right?
So I on social media, I see a lot of people talking about like just actually like taking antiparasitics because they want to like pass things out, and they're like, well, see, like actually if I checked, and ever since I've been using this, it's coming out. So that means I had parasites. In some of my little theory is like, what if it was dormant and not bothering you, but the antiparasitic activated it? Or 2, you actually, could it be that some of these parasitic infections or co-infections, is it possible that some of them are like endogenous to us? Like we just have it. It's not even an infection in a sense, but under certain conditions, they manifest.
I believe so. So it's like, I always think of like the whole rainforest analogy, right? Where it's like, you walk through a rainforest, there's your bad guys in every corner, but everyone's kind of to themselves, right? Nothing's being bothered. Everything is in homeostasis, right? So we have parasites, viruses, bacteria, funguses, right? They all work synergistically. Without them, we don't technically survive or have any immune modulation or anything like that, right? So I mean,
we all have H. pylori. If you have everyone who does testing, it's always there.
And even H. pylori, everyone's like, oh, I have H. pylori from my breath test or from my blood test. I'm like, well, technically we have it. One, if it's elevated, then what's causing that environment to make that happen? It's not an infection
per se. It's an environmental, like you'd say, a terrain problem.
Exactly. So go back to the whole terrain theory, where it's like, what's becoming dysfunctional in the terrain that's increasing these organisms to be, hey, they're opportunistic, right?
Sure.
But even parasites, right? It's like 30% are you can visibly see when you pass them. The other 70%, you can barely see it to the eye. Right. So it's like
microscopic.
What are we actually doing here? And that's just GI related. So going back to the topic of Lyme and Babesia being that other co-infection, this is an intracellular parasite. So I do all the GI protocols I want. I'm never going to hit that cellular parasitic red blood cell infection. That changes kind of the approach, let's say, right?
Do you get a lot of resistance with that idea? Because some people can handle, it's like, I got an intestinal infection or a parasite. But when you start saying it's in your blood or in your cells, then people are like, well, no, my doctor said if you got an infection in your blood, you're septic, 104 degrees Fahrenheit, or Fahrenheit fever. What do you say?
Yeah, honestly, for those people, I find like they like to see things like clinically on paper too. So it's like, okay, if you want to see if you have them, we'll test for them as much as the testing allows it to, right? Because obviously even parasitic testing from the functional side is still ever evolving. The sensitivity is not fully there, but like, hey, let's see it on paper. If it comes up positive or negative or the specific ranges, hey, let's do a parasitic cleanse. So, but I think I'm not the person to, hey, let's waste money on these labs, to be honest with you. It's more educating. And if they kind of resonate with that, then great. Yeah. If they don't, I'm just being completely honest with them. But there is a lot of pushback when, my doctor said this, and parasites are all over social media and TikTok, and they say they do all these symptoms. I'm like, but that's great. But there's obviously other things involved with that are making your symptoms flourish too, right? So it's never just, hey, I have a parasitic infection that I have to get rid of, right? It's usually like, what's the cocktail of the individual? So what's in my cocktail that I need to fully address and to create back that homeostasis? Yeah. That includes any pathogen, any tick-borne stealth pathogens, any trauma, right? Any immune deficiency, nutritional deficiency, right?
Yeah. What are some common nutritional deficiencies you see in these types of patients?
Vitamin D, huge.
Really?
Even if it's crazy, even if their levels are like normal, it's still
not enough.
It's still not enough, right? With Lyme, Lyme is like literally it blocks the receptors of your vitamin D.
Wow.
So even like testing, you would want to test both, like the I-25 and 25. And even at like how fully accurate is it? We don't know. But like they should be technically dosing till, if you feel toxicity symptoms, which is almost rare because, hey, if receptors are getting blocked, it's like, well, how much am I actually absorbing from taking, say, 5,000 IUs of vitamin D for these people who have these issues, right? So it's like they have to stay on it pretty much through kind of treatment, right? Yeah. But it's never like a toxicity limit for them. It's just, hey, if we want to modulate the immune system during this process too, from a nutrient standpoint, pretty significant to do, right?
Yeah. What's the timeline for recovery? Like how soon do people start feeling a difference versus how long does it take for like almost like a remission where they're like, I'm good now?
I think this is where I get the most pushback. Or people get the most depressed because, from literature and from personal experience, to treat a specific chronic infection like Lyme and these other co-infections, 12 to 24 months.
I was going to say, I thought it would be up to 2 years.
Not to say you don't feel better within those 12 months, but we know the healing roadmap, right? As long as we're on an upward trajectory, we're still going to ride those ups and downs. Yeah. That's the thing. So when you go back to treating or supporting Lyme, you want to tackle as much of the infections because it's more than just Lyme always, right? And the persistent, and then you get into the whole biofilms, right? So the longer the infection has been there, the more biofilms you're going to have to target.
I mean, I think people are learning about biofilm, but like, what do you think is like the best way to either identify that it's there and then how to treat it?
I wouldn't say there's a test for biofilm specifically. I mean, if you're doing, say, a functional lab test like a GI map, and Pseudomonas is coming up, that can give you indications that I have biofilms in the GI tract, right? If I see like an organic acids test and I see a lot of those bacterial markers elevated, plus like, you know, the mold markers like the aspergillus, you can kind of get segue, hey, I have biofilms. But if someone has, you know, even if they have just one of the tests for Lyme, you know, positive or their IgG markers and they've had it for 10 years, I'm going to already suspect there's biofilms in play. So that's going to be part of incorporating, hey, we got to target these organisms, plus, hey, we got to bring in some biofilm disruptors to help.
What's a good natural biofilm disruptor?
So actually, stevia is studied to be very, when we talk about Borrelia, Lyme types of biofilms, when you get into like Bartonella, so Bartonella is more, they create more fibrin complexes, right? So now we can use, you know, there's serrapeptase, nattokinase, but now there's lumbar kinase, which ends up being 16 times more effective. Now there's aqualaurin. So aqualaurin is the water soluble of monolaurin. So that's able to get into like the water matrix of the areas and degrade biofilms into like, you know, when we think of like bone and cartilage, into that synovial fluid area. So those are good biofilms. But those are the three I would mostly use or rotate type of thing, depending on like what we see from, hey, what types of infections are in play, like those 3 Bs again. But yeah, I mean, even that can be very powerful for people. So you would have to bring it in accordance to how they're feeling, right? Because you don't want to just knock them down. You want to support, right? And they need to be kind of, you know, ready for these phases, right? Because these are more, hey, you break open a biofilm, you're going to release a lot of like inflammation, cytokines, right? Causing mast cell activation and all that.
So what would a symptom of that feel like for the average person?
Like when they have
fever, or would it be rashes?
So technically any symptom, when we think of like histamine mast cell, if someone has more neurological, they're going to get increased anxiety, depression, increase if they have like tingling and buzzing sensations, heart palpitations, body pain. Generally, if you think more of like Lyme Borrelia, fevers, joint pain, like very achy, skin rashes, right? Those are the most prominent ones. But it can honestly, depends on the person. If you find that they're getting increased symptoms off something, whatever those symptoms are, you know, you got to pull back a little bit, right? Because they're experiencing like overload, right?
Sure. Cool.
Yeah, it can be very complex, right? But
it makes sense. And it's like, I feel like it interconnects a lot of different, just the whole spectrum of symptoms someone could be experiencing. And they're like, well, I got a neurologist, and I got a internal medicine doctor, and I got a rheumatologist. It's like they're all subcompartmentalizing the body, not realizing there's probably just an origin story here that's just being ignored.
Yeah. Even with that, like if someone comes to me and they're already seeing like, hey, I see a neurologist, a rheumatologist, a gastro, I'm like, the red flag already goes up. I'm like, tick-borne infection just written all over that, mold exposure potentially, right? So I'm like,
that's the constellation.
I'm like, I'm not going to even run any functional testing. I'm like, let's just
have it. Let's just acknowledge the elephant.
Yeah. But it's just educating to those people, because
it's a hard sell.
They're not going to fully understand in 10 minutes.
Yeah. Yeah, right? Because they've been going through this for years, seeing specialists that they're scratching. And it's like, you're going to tell me in 10 minutes that you already know what the problem is.
Yeah.
Yeah,
exactly.
I believe it.
Yeah.
In all of this, I mean, I this is something that, I don't know, it's like a kind of thing I think about. What's your like general theory of relativity? What's like your theory? It's like, you know what? I know this, I haven't proven it yet, but I bet this is happening. You know what I'm asking?
Yeah, I believe there's a lot going on from other outside sources.
Tell a little. That
are creating, you know, whether it's, you know, the whole, let's go back to like the pandemic areas of the time, right? Did that increase specific conditions, issues in people? most likely.
Yeah.
Those are big triggers for underlying issues. And I think that's why you see increases in, hey, diseases, hey, now tick-borne infections are slowly starting to rise. But, if we stem back even farther that to the whole governmental system or new world order and what's going on in that field, it's like, man, there's definitely like a whole plan involved in the future, right? And even with Lyme, like, I don't mean to scare people, but the Lyme vaccines are already past third clinical trials and they come out in 2025, right? So just like, hey, we had COVID vaccinations come out, this is just another segue. So then it's like, hey, Lyme vaccines come out, you publicize it on wherever social media platform, people start to get fearful, just like they always did. People start saying, hey, we got to listen to this. This is what's happening. This is dangerous. And people will run and get these vaccinations, which are going to add to the whole, hey, cocktail of someone's toxin burden. But the fear, right? The fear, the money and all that kind of coincides. But, I've been not scaring people, but it's like, hey, you go play outside soccer or go hike on a trail and you have security points. You have your Lyme vaccination, because if you don't, you can't come in here.
Yeah, areas are being designated as high Lyme, high tick risk, and you can't go there unless you got a shot.
Yeah.
That's
kind of scary.
Yeah. And people, let's just, I guess, already address the idea, like a vaccine for Lyme is not going to help you. Clearly.
No. And there actually was a vaccine for Lyme. They actually pulled it from the market. Back in I think it was like 1980s, 1990s.
Yeah.
They had a Lyme vaccine called LymeRx. So with Western blot testing, it's different bands. So you'll test. So when you do a blood draw, they put it up to kind of like this stencil, and it shows like bands 30 to like 40. So what they did, the vaccine took out band 34 and put it in the vaccine. So, hey, I go get a vaccine. You have those antibodies. Yeah. So now what happens is they never put it back in. So when you go get a Western blot test, band 34 is the most prominent marker to be tested positive for Lyme. But that's not even in there anymore.
So they ignore it.
So you get tested negative, you get denied insurance claims, and you don't get long-term antibiotic treatment. So
because they're hiding the most likely indicator that you do have it.
Yeah. Yeah.
That's sick.
And they know people will stay sick.
Yeah.
People will go through that door. They'll stay in the hospital. More hospital stays, more medications, more specialists.
Yeah, in the hole.
Right.
Wow.
So that's it's kind of scary to think about, but
how about frequency?
I actually benefit off frequency specific microcurrent treatment.
What device?
So that's like so basically you're connected to specific frequencies, right? So
are they Lyme specific or symptom specific or both? Or
so they can be symptom specific, they can be organ specific, and they also can be condition specific, right? So frequencies, our whole bodies run on frequencies, right? Yeah. So it's like if I'm trying to incorporate something that's full spectrum in trying to create homeostasis in the body, right? I can program specific frequencies on, what are my diagnoses, what symptoms and conditions I have currently going on, right? And how can I use this on a daily, right? Because there's actually now home devices where you can use frequency medicine overnight during sleep. So it doesn't change, hey, I have to wake up and do this every day and incorporate these drops like 3 times passive. A day, right? So that's another, I forgot to bring that up actually. Frequency.
That's my little future, or like in the back of my mind, like I have to get back into frequency stuff, because I've used a little more of an experimental sense when I've done live blood analysis. Because when you do the live blood, within that first hour, you might see things you might not. If you wait 24 hours, and sometimes if you stir up the slide, you'll see some stuff. But if you put a frequency beside it, within an hour, the jungle comes out.
That's crazy, right?
It's fun.
and I could feel that from a physical standpoint, even doing it. It's like I go through an hour of specific frequencies. Yeah. Either I feel really, really good for 3 days because it's like, hey, that's like
what you
good.
needed.
That's what I needed. Or it's like, man, I'm not feeling good at all. What's going on?
Something's being fixed in the background.
Yeah. So I believe it's a huge component, right? I think everyone's like solely focuses on like, you know, whether it's tons of supplements and diet. I mean, those are all great too, right? I think herbal therapy is amazing because it tackles so much without, you know, going too crazy and like, hey, I got to take 20 supplements and binders and whatnot.
Yeah.
So frequency is great. And it's like we're spending money on something that lasts long term.
That's right.
Right. So yeah, supplements cost, you know, that's the problem with chronic Lyme is they're spending upwards of like, you know, $800 to $1,200 on supplements, right? Yeah. And then that's where I try to change. It's like, okay, we're gonna do like specific herbs, right? The budget is gonna run significantly lower. We're gonna explore other avenues, slowly start to add in things, right? Yeah, it's fun for me now, but it's not fun for the individual because they're stuck in, you know, this hyperactive state, not knowing what to do. And now there's so much like education, not even education, so much social media on anything and everything, right? So it's like,
well, you're kind of on the other end of things. Like you've gone down that road. And so when you see a client, you're like, I remember being there. It'll get better in about a month or so. And to the patient, they're like, I had to do this for another month.
Yeah. Yeah.
And it's like, well, talk to me in 2 years. And then you're going to be like, oh yeah, I remember, but that's in the past. I don't remember it now. But in the moment, I was cursing and swearing and hating life because it sucks.
It's difficult for sure. And that's where, you know, I guess in my profession now, it's like you're not just giving someone these protocols, right? You're their health coach. You're educating them along the way. You're giving them other tools to help understand. You're providing them education too at the same time. Right. So it's more than just, hey, take these supplements and we'll follow up in like 6 to 8 weeks type of thing, right? It's like, hey, we really need to understand the whole presentation, the whole kind of illness in itself. What are lifestyle tools we can incorporate and use, right?
Sure.
Mental stability. I think that's huge. And then even having like kids now, it's like, well, you're educating the parent, and then the parent has to incorporate these on their child too, and they have to incorporate how to take these things or how to manage their symptoms, right?
Yeah, because when you treat kids, you are treating the parent because you have to, like, the kids, they have resistance to an extent, but the parents can be like, no, but it's too hard. I can't take them off dairy, and they love their treats, and I just give them pizza once a week, and it's already part of their lunch program. I'm like, any more obstacles you want to put in? Like, you want them to feel better, but can you not twist my arm and like putting up more walls as I'm trying to take some down?
Yeah.
So yeah, I get that, and because Lyme's such a taboo topic, like there is no like. I mean, it would be fantastic if there was so many people on TikTok talking about Lyme as they do intestinal parasites. And I get like, if I see another post coming up, it's like, check out what I saw on the toilet this morning. Like, we haven't reached that critical level. I mean, I don't treat a lot of Lyme. I've had someone in the past that she was just so sickly. She's like, I know I have it. And she did the test, and it was positive, but for like a pre-infection. So it was probably I think it was the California-based one of those. Yeah. And I'm like, listen, let's try to find a medical doctor who's going to help you give you this, because they want to do the antibiotics, and I wasn't versed enough in the herbs. Couldn't find someone.
In Canada, it's very limited.
No one wanted even to touch it. No one. They're like, well, I'd have to. There was one local functional medical doctor, and they're like, yeah, but I have to see them as a patient. They didn't want to pay another initial fee, and I'm like, everyone's being really difficult right now. Like, I kind of felt like I kind of did my part. Like, let's bring in people that can handle. If I knew you back then, I mean, I don't even. Maybe you weren't where you are yet.
Yeah,
but I think there are a lot of other people that are like desperate or looking, and they suspect or they have no clue that they have it,
Mm-hmm.
They probably do.
Yeah, and that's the hard part, because even like these, you get your Lyme literate practitioners now all over North America, mostly obviously US.
Are they all clueless? A lot of them, depending on who, because I feel like you went through the trenches. You learned.
Yeah.
You did the from first principles, as opposed to someone who did a couple seminars and got a certificate.
Right. Did that too on top, but
I'm sure you'd be like, this is not correct. Like, you're making footnotes on the pages.
No, to your point, it's like, it's never just Lyme too. Mm-hmm. It's like, you have to understand the whole picture, because if you miss them living in a moldy environment, mm-hmm. if you miss, their occupations, let's say they're painters or exposures, and then you're going to miss like multiple pieces of the puzzle, right? Yeah, it's good to understand that there's tick-borne infection in play.
Yeah.
Great. But even like Lyme literate, like I said, Lyme literate doctors, now they have these certifications. Now they're charging triple the amount. So you charge triple the amount, but these people are the most chronically sick. They're going to be on treatment for 12 to 24 months. Treatment costs more because the herbs cost more, the saunas and all this costs more. Mm-hmm. And I'm like, that's not right. I'm like, and that I went through that. Like you don't even want to know how much I spent, upwards over 100K, right? And it's like, someone needs to not do that. So they need to be educated on like, where are we putting our finances when it comes to something like this and a diagnosis, right? Functional medicine doctors, integrative doctors, they're very smart, right? I'm not saying, hey, don't go see them, but it's like, understand, it's like, there's
got to be a sustainability.
There has to be sustainability, especially nowadays, right? We all know what's going on with, in Canada, like carbon tax and this increases and that. I'm like, well, how people just are not going to feel better because they can't even afford to do anything else anymore, right? Yeah. So, that's where I kind of like, man, you have to care for these people. Sure, it's a business at the end of the day, but you can't just like mark things up like crazy like that, especially like with the most sick people, right? It's kind of unfair, and hey, sometimes it is what it is, but that's where it's like care and commitment and understanding and talking to the individual, right? And then it's like, it's up to you who you want to kind of even like work with or help support you. Like, yeah, they have fancy, PhDs, that's great, but that still doesn't make a difference, right? In our world, in a sense too, right?
Yeah.
So yeah, it's hard, right? It makes it difficult for the individual. I went to like 30 plus doctors and naturopaths, right? How many initials, cost this, cost that. It's hard because like you don't feel better. Plus you're hearing more information. So then you don't trust that person. Yeah. They're not saying this. They're not saying this. I'm like, well, they're just put into that now this circle, right? And they're just going circle round and round and round, right? Makes it difficult for sure.
Yeah. But there's hope.
There is hope. It's just understanding, right?
Talking to the right people.
It's not going to be publicized, this stuff, right? They're not going to publicize, hey, mold exposure is creating microtoxins in your home and creating your illness, right?
It's funny because no one's talking about it. It's not advertised. Most people don't know, but some people know.
Correct.
And I find that there's a lot of areas in our world that there's information to be known, but you have to like find it. It's not going to get handed to you on a pamphlet. Be like, here, I made a summary. It's really easy for you to follow. You're gonna have to be like, this doesn't sound right. Something's not right with any of this. I'm gonna have to like sift through garbage to figure out like, oh no, this is what I had this feeling this was right.
Yeah, we have to go digging for this information, right? Technically, or someone has to go through this situation too.
There's
as well.
Be a motivation to have to
learn,
whether you have patience or you're going through it yourself.
Yeah, so that's where education needs to be, I guess, on our end, has to be promoted. But even like you see the advertising now for Lyme, I'm just looking at it and I'm like, that is not right. I can't believe they're like even saying that.
It's like, I feel like most things that at a government level is given to us, it's very much dumbed down. It's
very
like
dumbed
we're
down.
going to like give you the minimum that you need to know just to accomplish our end.
That's exactly what they're doing.
Yeah, because they don't want people to understand it. Because
No.
one, they probably don't fully understand it. And even the ones at highest levels, because they have people that are smart and they know this is this has been hundreds of years. This is not the last 20 years. And they're not going to just like give everyone a green light to know and have knowledge of our functioning world, our immune systems. Like they're going to just give like, well, you're all pretty dumb, so we're just going to make you feel dumber, but at the same time give you a little, and that's all you're getting.
Yeah, pretty much to make us feel dumb and give us that fear.
Yeah,
the fear factor, right?
So just do what we're going to tell you, and never mind. These are the one part that gets me is when they put a disclaimer at the on social media posts. It's like usually it's when it's COVID related, right? It's like, fact check or whatever, and I'm like, either don't say anything or come out and say what is really happening, because someone's trying to bring out some good information, and you're not saying they're wrong, but you're making people second guess it. Because as soon as you put a warning at the bottom of a post, you're like, this is false and fake news.
Of course. Yeah, that's a whole different almost conversation.
Yeah, I think that will be
right?
maybe in the future we'll do one on that.
Yes, for sure. That'll be great.
Yeah, no, that's really, really useful. I think we'll get a lot of good response, and I think a lot of people need to talk to you.
Yeah, I mean, I'm always open to conversations, right? And like educating. I think that's kind of my goal too nowadays, is to help educate, because...
Do you do that on social media?
Yeah, I try and post to social media. I mean, because it's so complex, it can be...
Yeah, you kind of have to soften it. Like, you can't just be like, hey, these are 3 Bs. Yeah. I mean, maybe you can, but at other times you're like, you just point to a herb.
Exactly.
And let people kind of fill in the rest.
It's just like obviously get them thinking, but like, obviously working in like a one-on-one clinical setting, it gets very complex, right? Like it's a lot of understanding, right? And it's, getting to find details. So there is still, we still got to be like on the functional approach too, but take everything else into consideration too.
Maybe get people wrapping their mind around like terrain, your gut health.
Huge, massive, right? So it's never just like treat the microbes. It's like understand all the components as well.
Yeah.
But like understand you, because you're experiencing symptoms, right? And how do we support those? But also how do we look at everything prior to that help coincide to, okay, what are the next layers of approach that we're bringing in, whether it's, changing herbs, bringing in binders, whatever it may be, right? So those are free tests. Mm-hmm. So it's like, I'd rather have a half an hour conversation longer, right, than let's spend $600 on a test, right? So that's how I kind of view it. I mean, the tests help provide clinical evidence, which is good and bad, but...
I mean, I come from very much your perspective on, well, why do you have to spend so much on a test if I already know what your problem is?
That's exactly it, right?
But because the level of understanding is so restricted, that test ends up being like, I don't know, you did a test and it shows that I have this, so I now I get it. As opposed to being like, I've done this, I know it. Because sometimes, and
there's a trust factor between the client and practitioner.
And unfortunately, even though there's cost, if someone wants to feel better, they do have to invest in it.
So true.
If someone, like, because I've had people be like, I'm really sick, but I'm going to pay $100 and I better get all the solutions and I'm not spending anything on supplements. I'm like, you're putting that cap on your, like, I'm not trying to buy a new house with the income from you. I just want to spend the adequate time and get you to buy what you need.
We're trying to provide them with the best resources as possible, right? And that's how it is in this world. We're trying to figure out, what are the best solutions as possible as we continue to, work on the vaccine too. Not just, hey, I'm working with you and this person. No, we're actually doing work on the background, trying to get additional information and resources. Understand.
But I mean, this sort of thing, even now, this is research. This is education. It's free.
Exactly.
People don't understand that.
Yeah, it's like a free session for people in a sense, right? But I mean, like I said, we're trying to educate as much as possible too,
Yeah.
right? So people start understanding these kind of concepts, or terrain theory, where things stem from, how to potentially create homeostasis, what to look at it, the broad scheme of things for people.
Yeah.
Right. It's like I said, don't just narrow in and go down the rabbit hole one thing. Like, okay, great, we can get as much research there, but still zoom out and look at everything, because it's like I said, it's more to it than just one thing. Hey, H. pylori from the doctor's office, I want to treat it with triple antibiotics and I'm going to feel better. I'm like, well, okay, well, it's your choice to do that. But like, I'm like, listen, there's more to that than just H. pylori positive.
Because then it comes back after 2 years and they're like, but didn't I already treat this?
Well, yeah, relapse rate in anything, right? Cancers, even persistent Lyme. It's like remission, hey, 2.5 years later, back again. Back to dormancy, back and forth, right? So it's like, again, addressing the whole terrain.
Yeah.
Understanding detoxification, right? I mean, we're bombarded with so many chemicals and environmental factors now, right? So it's like, how do we support the ongoing exposures? And then you have to treat an underlying condition. Yeah. I mean, yeah, it becomes more difficult, right, as time goes. But that's, government kind of have some say in that, or implements in that too.
Yeah. Okay. This is really, really good. Thank you.
Thank you.
And
appreciate it.
We're going to do more of this, I hope.
Yes.
Good.
Be glad to.